My name is Kara Moncrief. I'm the Clinical Communications Director for Viora. I'm sure you guys already know that. And what we are covering today is the reaction. So today we're going to go through all of the reaction didactic. So I will pull up the reaction workbook. So, you have that as a visual to follow along. And if you happen to have the reaction workbook printed and in front of you, that's great, just so you can take notes as I go. And then next week is, or I'm sorry, not next week, I forgot. Now we're doing them once every 2 weeks. So not next Friday, but the following, that's when we're going to be doing hands-on with the reaction. So I will be showing different things with like the ST and the BC and the FC. So that will be in a couple of weeks coming up here. Okay, so now we'll pretty much go page by page here in the workbook. So, okay, so everything the reaction can do. So we're able to treat cellulite, circumferential reduction, and refit. And refit is going to be skin tightening on the body. Think like post-baby belly or post-traumatic weight loss, or someone's just getting older and they have loose tissue to their skin. Facial contouring and the relift protocol. So relift is going to be a combination of the ST and FC handpiece. We're going to go through that. And then just overall skin tightening, right? So we have the ST handpiece, so we can do full skin tightening on the face, on the hands, on the neck, on the labia. So we'll go through, and stretch marks as well. So we'll go through all of these different protocols and everything that it can treat. Ooh, sorry, my phone's flashing. Okay, so the first thing that we will start with here, we'll go through the basics. Now, usually I wait to talk about this in a training because I actually like to show it, but since I can't show it right now, we'll walk through it. So the filter change. There is a filter in the back of the reaction at the bottom part of it, and that needs to be changed every 3 months. Now, if you go out of town for 3 months on vacation and you know you haven't used it at all, then that's okay. But if you feel like, oh, we've only used it a few times over the last few months, I would still highly recommend keeping that just very protocol. You're never switching that up, no matter how much you're using it or how little you're using it, every 3 months to really keep your system working properly. What happens is you're like, oh, I've only used it a few times, I'll wait. And then a lot of times we end up waiting too long, and we've seen a lot of complications happen because of that. So I just highly recommend putting a note in the room, putting a calendar reminder in your phone to change these filters every 3 months. If you are like, wait, where are my filters? I haven't changed them. I don't have any. You can always purchase those on myviora.com. So myviora.com, you'll click on the reaction device and then you'll find those filters there. They're not very expensive. The first thing that you're going to do is you're going to pull the little plastic piece out. And I always like to hold on to the back piece with my hand, because once you twist the tube off and that kind of slings back in, it's kind of hard to get that to pull back out, because the reason why we can pull it out so easily is because we have the tube attached. Once you remove the tube and that kind of snaps back in, it's hard to pull back out. So I lift it, hold on to the back part of it, twist off the tube, and then change your filter. If for some reason you see any glycerin inside the tube, that is an indication of two things. One, you're maybe forgetting to change it every 3 months. Two, you might be using too much glycerin during your treatments. You really shouldn't see any glycerin in the actual tube. So if you do, just think about those couple things and then adjust as you need to. So the filter, if it's really dirty, if it's soaked with glycerin, then that's another indication that, okay, we might be using too much glycerin on these treatments, or we're not changing it soon enough. So you'll dispose the dirty filter, pop in the brand new one. If there was glycerin in the tube, I just take a spray bottle of alcohol, a piece of gauze, get it damp with alcohol, kind of wrap it around my finger and go in there and clean all that excess glycerin out of the tube, because you want that gone. The first thing you do before you pop in your new filter is you're going to want to replace the O-ring. So there's an O-ring for every filter. So you'll replace the O-ring first, because if you try to do it after the filter is in, you can't get the O-ring on because the filter is kind of coming out of it. So first replace your O-ring, then pop in your new filter, then screw it back in. Also, make sure you have a good height when you're screwing it in. Make sure it's nice and tight. Don't force it. We don't want you to break it. But if it's not tight and you go to use it and you feel like your vacuum doesn't sound right, it's because you just didn't twist it in quite properly. So that vacuum isn't going to work properly unless that's truly really replaced the right way. So make sure that's nice and tight. And then you're done. Pop on the little door. A trick that I used to use a lot when I was training accounts is I would have them take a sticker or a piece of Scotch tape and with a Sharpie, write the date of when the filter needs to be changed. So if I came into your training January 1st, I would have you write January, February, March, April 1st on the back of that little door of the filter, so you know exactly when it needs to be changed. So that's a nice little trick just to not forget. There are fans in the back of the reaction. Just make sure that the fans are never too close to the wall or like curtains. If you have curtains hanging in your office, those fans can suck in the curtain and then it can overheat the motor. So just make sure that that doesn't happen. I think really everything else is kind of self-explanatory. You guys know how to power on the device. Software, we never have updates for the reaction, so don't even worry about that. Wheels and brakes, I'm sure you guys know how to use the brakes and wheels. And then there's an IR thermometer that comes with the system, but we'll talk about that in just a bit. All right, so let me see. Yeah, I'll talk about this for just a second, but I talk about this a lot more when we go into the protocols. So you have your RF level and your vacuum level actually on the handpiece, right? And you can either have an option of 1 through 4 for vacuum and 1 through 4 for the actual RF output. So you can see here, 1 very low, you know, it's not emitting a ton of radio frequency to the tissue. The vacuum's not really strong. And then as you increase it all the way up to 4, that's going to get high intensity of RF output, high intensity of vacuum. So I'll talk about really the vacuum levels and the RF levels that you're typically using and how you need to adjust that based on the treatment that you're doing. So I won't spend too much time on this piece of paper because I'll talk about it a lot later. All right, so now we'll get into the actual technology because we're using radio frequency, right? So what is radio frequency? Radio frequency is a form of electromagnetic energy. And when this electromagnetic energy comes in contact with our skin's tissue, our body doesn't know what it is. It's something foreign to the body. And because it's foreign to the body, our body naturally wants to reject it. And it's the rejection process of how we are building heat. So when our body and our cells reject that, our cells start to move around. So you're putting RF in, it's trying to reject it, and that rejection is making cells move around in the tissue. And we call that oscillation. So our cells start to oscillate, and then our cells within our tissue then starts to generate the heat. So we can get different biological responses depending on where are we putting the heat in the body. Are we putting the heat deep into a fat layer? We're going to get one biological response because that's where our fat is. And if we're keeping the heat a little bit more superficial in the dermal layers, we're going to get a completely different biological response because that's where our collagen elastin is. Other things are in there too, but that's primarily what we're focused on. But that's how it's working. It's the way our body rejects it and our cells start to move around and our cells start to generate heat within the tissue. The thing I really like to talk about on this page is the importance of, in a consultation, talking to your patients about hydration. Radio frequency is attracted to hydrated cells. It's attracted to H2O. So the more hydrated the patient is, the better response that the body and the tissue is going to give. So we recommend drinking 1 liter to 1.5 liters of water before every treatment. Now that being said, that's really not the exact number for everybody across the board. If you guys want to get really technical with it, which I probably, if I owned a med spa or if I worked at a doctor's office doing consultations, I probably would get technical with it in the amount of water that they should be drinking. And on your phones or on your computer, you can pull up a water calculator and it asks their, I think their age, their height, their weight, and male or female. And it calculates the actual amount of water we should be drinking every day based on that individual. So you really know they have proper hydration before they're coming into you to get their treatment done. Again, that being said, I would recommend in a consultation talking to them about drinking water every day throughout their course of treatment. Reason being is we may have individuals that drink coffee during the day and wine at night, and they're not drinking their water. And then they chug a bottle of water as they're coming into you. Are they really hydrated? No, they're going to still be dehydrated. It takes more than that to hydrate the body and hydrate the cells within our tissue. So make sure in a consultation, just let them know every day throughout the course of treatment, try to aim for this amount of water based on your water calculator of how much that individual really needs. Okay. Any questions, by the way? You guys can unmute yourselves and ask. You guys can write in the chat. Never feel like you're interrupting me, because you're not. I understand. We move quickly. We move on to the next topic and the next subject. So anything that may not make sense, or just questions that you've had in general that I may not be answering, please ask. Okay. So now let's go. So I can't figure it out. Okay, so there's two ways of delivering radio frequency to our tissue. The first way, it's still used in hospital type environments, because RF is used more than just cosmetic reasons. It's used in certain surgical procedures. It's used in treatments of cancers. It's used even outside the medical industry. But the very first type of RF that came out for cosmetics was called monopolar. And there were a lot of issues with monopolar. The reason being is monopolar means there's one electrode on the handpiece, and then they had to use a grounding pad. The reason for that is radio frequency has to have a positive to negative delivery. So the electrode on the handpiece was working as the positive, and then the grounding pad that was usually placed under their back was used as the negative, which would really receive all of the energy. So you had to use really high amounts of RF because it would have to scatter throughout the body to find the grounding pad. Then when you had to use really high amounts of RF, it wasn't controlled. So you have RF that's not controlled, it's scattering, plus really high amounts. It was creating a couple problems. One, it was really uncomfortable. Really uncomfortable. Sometimes the offices would have to sedate the patients. Even then it was uncomfortable for them. Additionally, it was the adverse events that were happening. You could get permanent divots in the skin, so permanent fat loss. A lot of times it would happen in the face because it's more superficial here. And sometimes it could happen on the body though too. So those two really, people not really wanting to do monopolar because it was uncomfortable. And then of course, people that had adverse really didn't want to do it. So the industry then evolved to bipolar energy. And that's when Viora came on the market, was the reaction. So the reaction was bipolar energy. We never used monopolar. So bipolar, why it's so great, is whatever handpiece that you have, the ST, the electrodes are right there. The FC, the electrodes are spread apart about that much. And the BC, it's spread out about that much, but it's very controlled. One electrode is working as the positive, the other electrode is working as the negative. So it's delivering and receiving. We are using relatively low amounts of RF energy to be able to do the exact same thing because we're doing it in a controlled method. So it's very rare that we will ever get into any type of adverse that we would see with monopolar. Plus, it's really comfortable. And then the next generation of RF came out, and that's multipolar. So there's tripolar with 3 electrodes. Our V form on our new RF series, which is on the V10, V20, and V30 platform systems, we kind of upgraded in a way with the V form where we have multiple electrodes. So the small tip has 4 electrodes, the medium-sized tip has 4 electrodes, the large tip has 6 electrodes. So even though it's multipolar, it's still in a sense working as bipolar. It's just we wanted to create a really big handpiece, that's what the V form is, and have 6 electrodes so we can have a big handpiece, build heat really nicely, but be able to treat larger areas of the body. but it's still working in a sense of bipolar energy. It's still delivering and receiving, delivering and receiving, delivering and receiving. That's how energy has to work. It just delivers and receives. They're just switching. So it's still in a sense about the same, just more electrodes. Okay, so I was talking about different biological responses that we can get with RF energy, depending on where are we putting the heat in the body. So we'll talk about the first depth first, is going to be our hypodermis. So hypodermis, it falls right below our dermal layers, the papillary and the reticular dermis, where our collagen and elastin are, is right below that is the hypodermis. Another name for it is adipose tissue, because adipose is fat. Also subcu, the subcutaneous tissue. So lots of names for that. But let me see, do I explain this to you now? No, I'll wait. Okay, so when we put the heat in our deepest depth, which is going to be our fat layer, the hypodermis, what are we doing? So what we're doing here is we're stimulating lipolysis. So lipolysis is when we take an enlarged fat cell and in a sense we dehydrate it. So when we do this with a certain amount of heat and holding that certain amount of heat for a certain amount of time, we're able to take enlarged fat cells that we don't want, right? We have a little pooch on our belly or cellulite. We don't want these enlarged fat cells. So in a sense, we're dehydrating them, we're shrinking them down. Fatty acids, triglycerides, water, all of those things are able to really escape the fat cells. And we have two things that help us really rid everything that came out of those fat cells. We have blood and we have lymphatics. And blood and lymphatics, the circulatory system and the lymphatic system, they just work together. So it's kind of like one unit. But we're increasing cell metabolism within the blood vessels. So that is going to help really get rid of everything that we're breaking down in the fat cell. And additionally, lymphatics helps rid all of the fluid as well. So it's those two systems, and those two systems are really prominent in the hypodermis. We have a ton of lymphatic vessels. We have a ton of vascularity vessels within that layer. So we're really lucky there, because when we do shrink these fat cells, they get to work and really metabolize everything at that point. So we have to hold the temperature between 39 to 42 degrees Celsius, and we have to hold this temperature for 10 minutes to stimulate this lipolysis. I sometimes get the question of, well, what if I were just to do, somebody's submental here, right under the chin? Can I do it for 5 minutes because it's a small area? No, we can't. It has to be 10 minutes because that's the biology behind it. We can't change that. We can't change how the body responds to heat and the amount of time it takes to respond to that heat. So it has to be 10 minutes. It doesn't matter how large of an area you're trying to treat. It's just the overall biology behind the science behind it, really. Okay, so that's our deepest depth. Now, when we take the heat a bit more superficial into the reticular and papillary dermis, those are our two layers right above the hypodermis. With the reaction, we're never working as superficial as the epidermis. That's going to be things like microdermabrasion, IPLs, some lasers, peels. Those are the types of things that are working on the very surface, the epidermis. With RF, with reaction, I should say, it's working more, think of it more of like a deep tissue heating. So when we take it a bit more superficial though to the papillary and reticular dermis, what we're doing here, we're getting a totally different biological response, but with the same temperature. So we're still holding it between 39 and 42 degrees Celsius, but with this, when we're in these layers, this is when it's going to focus on collagen and elastin. How does it do that? So within collagen and elastin, we have these they're called fibroblast cells, and they're attached to the collagen within our skin. And what their job is it's pretty much looking for injury in the tissue. So if we cut ourselves and we bleed, we know we're getting down to at least the papillary or reticular dermis, because the epidermis is avascular. There's no vessels in the epidermis. When we cut ourselves and bleed, we know we're getting deep. So when that happens, these fibroblast cells that are connected to these collagen strands, that's their job, is to get over there, migrate over there, and start to heal. And it's healing with collagen. And it secretes collagen fibers. So fibroblast cells are actually secreting the fibers to produce the collagen. So that's what we're doing with heat. We're creating these little microthermal injuries to the skin, and then it really wakes up those fibroblast cells and says, all right, we have some kind of little microthermal injury going on here. I need to heal it. It's kind of tricking it. And they start to secrete collagen and help strengthen elastin. So that's how we're getting our overall skin tightening to our skin. And I'm going to talk about when are we using, the Handpiece for skin tightening, when are we using the Handpiece for fat, and sometimes we're mixing both. So I'll talk about that as well. All right, any questions so far? We're good? All right. So now we'll go into our modes. So before I really break down the modes, I want to simplify it for you. I want you to think of your modes like a 3-story building, okay? Think of mode 1 like the first floor of a building, mode 2 like the second floor of a building, mode 3 like the third floor of a building. Picture a building dropping into your skin. So this building just falls into your tissue. Where is mode 1 going to be? It's going to be the deepest depth. Where is mode 3 going to be? It's going to be the most superficial. And I feel like when people first start using the reaction, they can get this confused because naturally our brains want to go to mode 1 would be the most superficial. But it's opposite because with radio frequency, we're always working our deepest depth first, and then we're working at more superficial. So that's why mode 1's the deepest. So if it's ever confusing, just think of that 3-story building. Okay, so we have three different depths of penetration with the reaction based on the modes we're using. And I'm going to explain what these numbers mean here in the center. This is 0.8 megahertz. This is 1.7 megahertz, and this is 2.45 megahertz. So when you want to go deep and you choose mode 1, it's using 0.8 megahertz. When you want to stay superficial and choose mode 3, it's using 2.45 megahertz. So again, sometimes people get that confused of, well, wouldn't I use 0.8 megahertz if I wanted to stay superficial? And it's opposite. And the reason being is we measure radio frequency in the frequency in which the wavelength is traveling. With IPL and lasers, if you guys are familiar with that at all, we are always measuring light-based technologies in the wavelengths of the wavelength that we're using. So almost everything in life, almost everything around us is part of the EM spectrum, electromagnetic spectrum. Things that are on the spectrum, X-rays, radio waves, our TVs, UV light when we go outside, our cell phones, the light that I'm using now for this video. Whoa, that just really brightened up my screen when I did that. The light that I'm using for this video right now, almost everything that surrounds us. But radio frequency, IPL, lasers, almost everything we're doing within the cosmetic industry that's dealing with the technology for sure is part of this EM spectrum. Okay, so with this spectrum, we have wavelengths. So we have short wavelengths and we have long wavelengths. Really short wavelengths are like UV. Those are shorter wavelengths. You know that UV can be very dangerous to our skin. Shorter than UV wavelengths is going to be X-ray wavelengths. And think of like when you go into a hospital and you see a sign saying, you know, X-rays in use, do not enter unless you're wearing like a lead vest. You know, they protect you because they know the shorter the wavelength, the more dangerous it is. Okay, and then we have really long wavelengths like infrared spectrum, radio waves, so on and so forth. So wavelengths, how are they short and how are they long? Okay, so short wavelengths, how we know that it's either staying superficial or going deep into the skin. Certain lasers are superficial wavelengths. Other lasers are deeper wavelengths. How do we know that? A 530 nanometer wavelength is staying more superficial than a 1064 nanometer wavelength. And the reason being is it's the frequency in which it's peaking. So if a wavelength is a short wavelength, it has a very high frequency, meaning it's very quick and peaking many, many times within a second. And then a long wavelength has a low frequency. So it's only peaking a few times within a matter of a second. So think of it as like slower. A short wavelength is very quick, so it's staying superficial on the skin, where a long wavelength is very slow and it actually has time to get deeper into the tissue. So when you slow it down, it travels deeper. So that's what these numbers are. 0.8 megahertz, it's not as fast, so it's going deeper into the skin. 2.45 megahertz, it's quick, so it's staying superficial in the tissue. And that's how we're able to establish our depths of penetration, okay, using our different modes. Now I'll break down each mode. Okay, so mode 1. Mode 1 is our deepest depth, and this is just a review. We are in the hypodermis or subcutaneous or adipose tissue, where our adipocytes are, and our fat cells. And what we're doing here is we're maintaining that 39 to 42 degrees Celsius. I always try to push towards 42 degrees because not everywhere on the body holds the exact same temperature. So if you're only holding 39 degrees at somebody, they will tend in some areas to drop under that, and then you're not in that efficacious zone that you need to be in. But if you're pushing more towards 42 degrees and you drop under a little bit, it's okay because you're still in range. Some people are not comfortable with 42 degrees, you know, it's too hot, they may be jumping around. That's okay, you can, you know, keep them at 40 or 41, but I just try to push it just a bit if I can. So you need to hold that temperature for 10 minutes, and that's what you do to stimulate lipolysis. So that's mode 1, our deepest fat. I want you to think of mode 2 and mode 3 pretty much is the exact same thing. They do the exact same thing. Just one is a little bit more superficial than the other. So mode 2 is going to go into the reticular dermis, right above the hypodermis. Mode 3 is going to go into the papillary dermis. But the reason why they're pretty much the exact same thing is because both the reticular and papillary layers are made up of all the same stuff. They both have fibroblast cells. They both have collagen. They both have elastin. They both have glycosaminoglycans, GAGs, hyaluronic acid. You know, they both are made up of the same substance. Why do we have mode 2 and 3? Because we want to stimulate the collagen in both the papillary and the reticular dermis to make sure our skin stays nice and thick and also tight and strong. So mode 2 and 3, what we're doing is we're creating those little microthermal injuries to the tissue. Those fibroblast cells stimulate, they start to secrete, and we get more collagen, larger strands of collagen, strengthened elastin, which means we get a bounce back to our tissue. That's what elastin does, and a thickening of our skin, because that's what collagen does. In specific, it's types 1 and 3 collagen. We have 20 some different types of collagen within our body. Everything in our body is made up of collagen in some way or another. There's dense collagen that ligaments and joints have. There's loose connective tissue. That's what our skin is made of. Our lungs, our heart, everything's made of collagen. So the cosmetic collagen, and that's our skin, it's types 1 and 3. All right, so those are our modes. Now, we do have a mode 4. We only have 3 depths of penetration though, but we do have a mode 4. So what is that? Mode 4 is going to be a combination of all 3 of those modes at the exact same time. So when you're using mode 4, 1/3 of the energy is going to mode 1, 1/3 of the energy is going to mode 2, and 1/3 of the energy is going to mode 3. Why do we need this? For 2 reasons. 1, to preheat the patient, and 2, for one of our protocols. So I'm not going to talk about the protocol right now. I'm going to save it because it'll get confusing, but I will talk about preheating the patient right now. Why do we use mode 4 for preheating the patient? Well, we can have all 3 depths of the tissue being heated at the same time. So it heats them very, very quickly. You're not putting heat on very superficially and waiting for it to push down, or vice versa. You have all 3 depths going at the same time, so usually you can preheat them very fast, but at least in 5 to 6 minutes. By the way, if it's taking you longer than 5 to 6 minutes to preheat, there's things that you'll need to adjust, and I'll talk about that adjusting your stacked pulses, adjusting your RF level, adjusting your vacuum level, adjusting your zone size. There's lots of tricks to that. So I'll talk about that in just a bit when we get into the protocol. And another reason why we use mode 4. Any questions so far? We're good? 30 minutes. I think this is going to be about, I'm guessing about 2 hours for the full webinar, because all the handpieces and protocols that we're going to go through, refit, relift, ST, contouring. So I will break us at 1 o'clock. Yeah, so we'll break in about 30 minutes. However, I need to grab something really quick, so I'm going to be back in 2 minutes. Don't log off or anything like that. I will be back in 2 minutes. And then we'll take more of like a 10-minute break at 1 o'clock. So just give me just 1 second. I'll be right back. Thank you for bearing with me. All right, so we'll now talk about the vacuum. So the vacuum is very, 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 very important. There are systems on the market that do not have vacuum, that just have heat, and they see a huge lack of result for many reasons. So we'll talk about why the vacuum is so important. One of the reasons is it's going to help with depth of penetration. So if somebody really has a larger abdomen, their fat layer is going to be significantly thick. So we want to make sure that we're really pushing deep into the fat layer so we're able to really treat it as a whole. So it's going to help with depth of penetration. Secondly, it's going to help with microcirculation. And microcirculation does wonders to our skin. So when we're able to get blood flow to our tissue, then we get overall oxygen and nutrients through the skin. So then the skin is overall just going to respond better to everything that you're doing to it. So hence, then, we have radio frequency to, tighten and shrink and, all those things. So blood circulation is just, a major factor in getting those results. Additionally, it's going to work with the lymphatic system. So remember, any excess fluids that we have, that fluid buildup, edema, it's going to really push it through that lymphatic system, so then our body can get rid of it and process it. And then additionally, I'm going to skip a couple slides here really quick. Okay, I'm going to come here. So additionally, it's so important for cellulite. So I'm kind of skipping, but I like to talk about cellulite here because really the vacuum does half the work of cellulite than even the heat. So I would say heat half, vacuum half. with cellulite, so I'll start with over 86% of women have cellulite, under 8% of men do. And the reason being is our hormone difference and the way that their connective tissue is, the density of it, women compared to men. So men have a lot more connective tissue in that area, and it's really irregular, where women, it's not as irregular and there's not as much. So here, these are called septae, and this is part of our connective tissue. Men's are shaped a bit differently. It's almost like a diamond. So you can see here that when we gain weight, these fat cells enlarge. Where are they going to go? They're going to push to the sides and start to push these septae, but they're going to start to push from below. So we start to get a dimpling effect because of that. And then these septae, and men's are more controlled. They really don't have this issue. And then what happens here is these septae, they're supposed to be nice and fluid and really move easily. And they start to become very rigid and hardened. And that starts to pull down on the skin. So that's another issue. So with heat, and especially the vacuum, we're able to massage these. So when we massage them, then they become a more relaxed and loose and not so rigid, pulling down onto the skin, or pulling from below on the skin. And then we're able to, with heat, shrink these fat cells so they're sitting nice and low at the bottom instead of pushing from here and creating another dimple. So that's why the vacuum's so important, is because we really do need to get in there and massage all the septae. All right, I'll talk about that a little bit more when we go back. Oops, I'm going the wrong way, I think. Okay, so those are the importance. I think I covered them all. The importance of the vacuum, depth of penetration, microcirculation, lymphatics, massaging septae for cellulite. Very, very important things. Here, I don't know if this is going to let me zoom. Oh, it is. Okay. Here's a table where it shows the depth of penetration depending on the handpiece that you're using. So this is the BC, your largest vacuum handpiece, and then this is the FC, your small vacuum handpiece. So the BC, here's the vacuum level. 4 is the highest. If you're on the frequency of 0.8, that's mode 1, you're getting all the way to 18.6 millimeters deep. And with vacuum 1, the lowest at the same depth of penetration, you're only getting to 11.3 millimeters deep. So you can see how important that vacuum is in really pushing into the fat layer. And then the same thing with the FC. 0.8 at the highest vacuum level, you're getting to 10.7 millimeters. And then at the lowest, you're only getting to 8 millimeters. Also, that is, this is very helpful in understanding the handpiece that you need to choose for the area. So you're never going to want to use the FC on the abdomen. First of all, you wouldn't want to do that because it's small, but I've had some accounts do that where a woman comes in who's thinner and they're like, oh, it'd just be easier to use the FC. Then they may contact us like, we're really not seeing results. Well, this is why. It's only going 10.7 millimeters deep at the highest vacuum, where you're reaching 18.6. That's a huge difference in millimeters with the large. So our fat is much deeper on our body than it is on our face. So the FC is going to reach the fat just fine here on the face and in the submental or thinner areas like the arms or above the knees. But larger body areas like the abdomen and the thighs and the buttocks, we definitely need the large one because of that depth of penetration. And plus, it's a lot easier. You're not working forever to get them heated or to hold heat. All right, let me get it out of here. There we go. All right, so we have, I'm just gonna take a sip of my coffee. So I'm not gonna be on this screen for long. I'm just gonna actually show you the handpieces. So here's our large, our BC, our FC, our smaller vacuum, and then the ST. So the ST is the last thing that we'll talk about today. But the workbook is nice, especially like if you guys are just starting to use the reaction or you just hired a new operator and you're training them for the first time, this workbook is great because it goes through all the important details. For instance, we're never going to use ultrasound gel with the vacuum handpieces because it would destroy them. We're using glycerin oil with the vacuum ones. So they're just nice reminders of how we're doing it, what kind of materials are we using on the skin for each handpiece. Down here, BC is for buttocks, thighs, abdomen, FC, more sensitive areas like the face, chin, underarms, and inner thighs. I mean, you can still use the BC on the inner thighs. It can just bruise easily, but we'll talk about that in just a bit. But yeah, this is just a nice, little cheat sheet here and a reminder. All right, so now we're going to go into our first protocol. So we called it the body contouring protocol. Oh, there it is. Okay. Let me see where I want to put you guys at. Give me 1 second. Sorry. Yeah. Okay. I'm going to come here. There we go. I went too far. There we go. So let me enhance it just a little bit more. Almost there. Great. So this is what we're going to concentrate is the bottom of the screen here. So this is the body contouring protocol. Now, we named it body contouring, but it's not just for body contouring. This is the protocol that's anything that's fat related. So it could be body contouring, it could be cellulite reduction, it could be circumferential reduction. So really anything that is in relation to fat, and primarily body contouring and cellulite. Circumferential reduction just comes with body contouring. So first step we're going to do is we're going to always preheat in mode 4. Remember, we want all 3 depths going at the same time so we can preheat them fast. We are working in the direction of the lymphatics. If you guys ever forget direction of the lymphatics, just think towards your heart. So legs, we're working up towards the heart. Arms, we're working down into the underarm towards the heart. Abdomen kind of goes against that. Abdomen, we're kind of working in and slightly down if you'd like. But if you just work in, that's fine, because a large part of our lymphatic system is found in the groin area. Face, we're working out towards the ear, to the lymph nodes here. So also think like when you get sick, where are you achy? We get achy in the underarms because the lymph nodes are under attack, right? They're trying to attack any type of infection that we have going on in the body. Our ear area gets really achy, so that's the direction you'll be moving in, or towards the heart. Abdomen just goes against that because of the groin lymphatics. So we'll work towards the groin area, or just in is fine. And then RF, you would choose between a level 2 to 4 and a vacuum level 2 to 4. Most of the time, for most of your patients, you'll be at vacuum 3, RF 3. It's a medium level of vacuum. It's a medium level of RF output heat, and they're typically comfortable with that. You can typically get them preheated in 5 to 6 minutes. They can typically lay there and say this is comfortable. But if for some reason you cannot get them heated, you've been working and you're like, the temperature's not going up, and maybe they had grade 4 cellulite. So when you touch it, it's ice cold to the touch. It's going to be harder to preheat because it's poor circulation in the area. So what I like to do is ask them, if anything was bothering you at all right now, would it be the heat that you're feeling, or would it be the vacuum sensation that you're feeling? And if they say, maybe the heat, then go up in your vacuum. If they say, it's the vacuum, it kind of is pinching me, don't go up in your vacuum because it's going to pinch them more. Go up in your RF energy. So you can always go to 4s if you need to. It's just most people are not like the most comfortable at RF4 and vacuum 4. Some people can tolerate it though. Just really depends on the patient. So you'll get to know them in their first treatment. Take your time. If for some reason you're at vacuum 3 and RF 3 and they say, oh, that vacuum's pinching me really bad, or you start to see really bad bruising, go down in your vacuum to 2. That's okay. You just don't want the vacuum all the way down to 1 because you're not getting to the depth that you're needing to be at. So that's adjustable, absolutely. You're going to do stacked pulsing. So you're going to hold, and again, I'm going to be going through hands-on demonstrations in 2 weeks, 2 Fridays from today. So I'll actually show it to you guys. phone is driving me bonkers. It keeps flashing. All these phone calls coming in. So you'll hold down the handpiece and you'll hold it and you'll trigger 1, 2, 3, 4, and then you'll move it 1, 2, 3, 4. I usually like to start with 4 stacked pulses and ask them, was that okay? And if they say, yeah, that was fine. Okay, great. If I'm having a hard time heating them within a couple minutes, then I'll try 5 stacked pulses. Is that okay? Yeah, it's fine. Okay. You know, sometimes I even start with 6 stacked pulses to get them preheated really fast. So it just kind of varies, but now thinking back, because I haven't trained on the reaction in a while, now thinking back, I would do 6 stack pulses to start. Usually everybody was comfortable with it, but if some reason they weren't, they said that last one was too much, then I'll drop it to 5. If they still say that last one's too much, then I'll drop it to 4. So you can play around with that, but up to 6 stack pulses is fine to get them heated quickly. And what you're going to do is a little swivel motion. So 1, 2, 3, 4, 5, 6, let's say that's what you're doing. Then you're going to swivel it. 1, 2, 3, 4, 5, 6, swivel it. 1, 2, 3, 4, 5, 6, swivel, come over here. Let's pretend like this is my abdomen. Over here, 1, 2, 3, 4, 5, 6, swivel it, swivel it, swivel it, swivel it, swivel it, swivel it. So I'll show that swiveling technique in a couple weeks on the hands-on webinar. And the reason why we do a little swivel is to really release the vacuum from the skin. Because if you just pulse, 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 drag, pulse, 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 drag, you're dragging the skin so much that it's really not a great thing for the skin whatsoever. Plus, you're going to get a lot of bruising. If you pulse, 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 pull up, put down, pulse, 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 pull up, put down, that's not good for the skin at all, and you'll get a lot of bruising. So that's what that little swivel motion just releases that vacuum a bit. So you're helping with the bruising. Now, that being said, it is a vacuum. So I would talk to your clients in the consultation and say, there is a high probability of bruising, and making sure that they know that. It's when you don't tell them is when you get the call the next day of, what did you do to me? They weren't expecting it. So I always say, you know, what would happen if I sucked on your neck? You're going to bruise, you're going to get a hickey, right? And that's the same thing as a vacuum. You're breaking little blood vessels. It's not going to be bad. It's not, you know, it's not a bad thing, but it's something that happens with the vacuum. So, but making sure they know the positives of the vacuum, you know, we're helping increase the circulation. We're helping to really get down into the vat, but you could have some bruising. Oh, that's okay. I don't care. I'll just wear pants. You know, that's usually how they respond. So, but telling them is important. Okay. So then you get them preheated, and you want to get them preheated to 39 to 42 degrees, and make sure everywhere is that temperature, and then you move to your next step. So once every area is reading at least 39 degrees, then you drop it to mode 1. Now, I forgot to tell you guys 2 things. I don't have a piece of paper here. Let me, hold on a second. All right, I have a sheet of paper coming to me. So first I'll talk about what you're using with the vacuum handpieces. So with the vacuum handpieces, we are always using glycerin, and always make sure that if you're gonna order more glycerin, that it's 100% vegetable glycerin. Never use anything else. I have, you know, kind of seen it all. I've seen people use vegetable oil and baby oil and jojoba oil, and there's a huge problem with using oils because of multiple reasons. One, your handpiece doesn't know how to filter out oil at all. It only knows how to filter out glycerin. And 2, well, the really the most severe thing is that oils and energy do not mix. It's going to create blistering on the skin, where glycerin doesn't have any type of oil, so it's safe for the tissue that you're working on. Plus, it doesn't absorb into the skin, so you have a nice slick, really you have what am I trying to say? Slick skin. To easily move. With oils, it's just going to absorb, and it wouldn't work anyway. So just make sure 100% vegetable glycerin is what you're using, and not too much. It should look like a light sweat on the skin, no more. It shouldn't be dripping off the patient. If it is, it's a huge mess for you. It's a huge mess for them. But moreover, that vacuum is just going to suck up any excess glycerin, and that's how the filter becomes really dirty. And if it becomes too dirty and too saturated with glycerin, then your vacuum is compromised on your system. So just a very light layer of glycerin. If you need to add more as you go, that's fine. Just don't get in the habit of adding and adding and adding. You shouldn't need to anyways. And it usually is about the size of a quarter to do like an abdomen treatment, let's say. Your zone size. Your zone size is about, and I'm talking about the BC right now, not the FC. So just the BC. The BC is about the size of a sheet of paper, your zone size. So let's pretend like this is my abdomen. That would be your zone size. Some people have really good circulation, so you might be able to do a little bit larger. If someone comes in for like abdomen and flanks, usually you would want to split them down the center. Do from the belly button to the back of the flank all in one, and then the other side all in one. If someone has a much larger abdomen, but be careful of the BMI that you're choosing, because too large of a BMI, they're not going to get a result anyways. So, but if someone comes in, you can tell that they're going to get a result. They have a larger abdomen. You may need to split it into 2 zone sizes, to keep the heat. So just think of that as a reference. It's about the size of a sheet of paper for the reaction BC. Okay, so now we have moved to, let me crack my head. Oof, it was hurting. So now we've moved to mode 1, our deepest depth, after we get them to temperature. And this is when we set our timer. So we set our timer for 10 minutes and we keep working in the direction of lymphatics. Make sure that you're always doing that when we're deep into the fat, which is mode 1. And we're doing as many stacked pulses as you need. If they're maintaining temperature at 2 stacked pulses, great. If they're maintaining temperature at 5, great. Whatever you need to do to keep that temperature. The temperature reading is number 1. Their comfort is number 2. So make sure you're getting that temperature, but you can adjust things to keep them comfortable if need be. Usually you're only having to do like 2 to 4 stacked pulses at this point just to keep them at temperature. And usually if you have them at RF3, vacuum 3, medium levels, and you were fine with that, usually you're at the same thing in mode 1 as well. So timer goes off, work in the lymphatic direction, abdomen we're working in, let's say, arms we're working down, and timer goes off. Now we go to mode 2 and 3. So they're coming in for cellulite, they're coming in for contouring or circumferential reduction. Why are you needing to do mode 2 and 3? If they're coming in for fat, why mode 2 and 3? Well, what happens when we're contouring an abdomen and we're reducing the fat and reducing the fat and reducing the fat? What happens then to the skin? We can get laxity. So we never want to replace one problem with another, that we've reduced the fat there, but now they're left with loose skin. So that's why we do a little bit of skin tightening at the tail end of the treatment. Mode 2 for 2 minutes only, mode 3 for 2 minutes only. Just get those fibroblast cells stimulated to really start to tighten the skin behind what you just did, which was shrinking the fat. Same thing with cellulite. Cellulite, we want to loosen the septae, shrink the fat cells down, but then also thicken the skin. All of those things combined is what gives a very smooth appearance for cellulite. So we do mode 2 for 2 minutes. And this is when we more so do a gliding motion. So lymphatics doesn't matter at this point because we're not in the fat layer. And you can do whatever you want. Just keep the temperature. You can do zigzags. Abdomen's usually easier because we have to avoid the belly button. Otherwise, you can arc them, create a little blister if you go over the belly button. So usually I do a tight circle around the belly button, into a medium circle, into a big circle, back in to a small one, back out to a medium, back out to a large one, so on and so forth. Legs, I usually zigzag up and down, or I just stop, come back down, stop, come back down, and just do in one direction or zigzag it, whatever you guys want to do. Just move around, keep that heat. You can draw them a photo and say, guess what I'm drawing? It doesn't matter as long as everywhere is getting heated. The big thing I want to point out in mode 2 and 3 though is that the vacuum level always drops to a 1. Why? 1, we're gliding, so we don't want to pull the skin and bruise it really bad, really terribly, right? And 2, the depth of penetration. At this point, we don't want the vacuum aiding in the depth of penetration, because if we have too high of a vacuum, we may push too deep back into the fat. At this point, we just want the frequencies to do the work for us. Target the reticular dermis, target the papillary dermis. So the vacuum is there just to have enough suction to stay on the skin safely. Any questions on that? All right, so now we'll go into the FC. What does it talk about? Oh, there it is. Okay. Okay, so now we'll talk about the FC, and then we'll talk about like number of treatments, how often, all of that. So I'm not going to spend a lot of time on this because it's super simple. If you look down here below, it's the exact same protocol for the FC. So the FC is what I'm referring to being the same protocol is contouring. So if you need to, somebody has a double chin and you need to treat the fat here. Someone has a lot of fat and they don't have a strong jawline and you want to really contour that area. Someone has fat on their arms. Somebody has fat on their knees. So you're needing a smaller applicator, but to do the same thing as the BC, protocol is going to be the same. The only thing that would change is you have to be very careful with the FC. And the reason why is the FC, we're usually using this one on sensitive areas. Arms are thin skin. Knees, you can be a little bit more aggressive with your vacuum. Inner thighs, thin skin, the face especially. So you really want to be careful on not turning your vacuum up too high on the body, and especially on the face and submental. Only keep your vacuum between a 1 or 2. Usually I start with a 2 to preheat them faster, but if I start to see petechiae, which are those little red dots that you know are broken blood vessels that are going to turn into bruising, then I immediately take it to vacuum 1. So same thing with like the arms, I'll do vacuum 2. If I can't get them heated, then I'll go to vacuum 3. So just be very careful because the FC we're usually using on very sensitive areas that bruise very easily. And we don't want excessive bruising. Some bruising is fine, not excessive. That being said, bruising, like on somebody's back of legs using the BC, let's say for cellulite, if they bruise pretty bad the first time, the second time they come in, it'll be half. The third time they come in, it'll be a quarter of that. The fourth time they come in, they may not have any bruising at all. So the bruising starts to subside as the skin gets stronger and healthier. So just know that you can tell them that. Listen, the first couple times you may have some significant bruising, but then it starts to fade away. And you won't have that horrible bruising every time. All right, you don't have to say horrible. You can choose a different word. I couldn't think of one. Okay, so that's it with the facial contouring applicator. These are just, you know, little reminders. So if you want, you know, you can download the workbook and read through this, but possible side effects and so on and so forth. So definitely read through it though, because it's everything that you'll want to know. I just won't talk about every single one of them. Otherwise, this would be a 4-hour webinar, and I know you guys probably don't want that. These next couple pages walks you through everything I just walked you through, the full protocol. Another reason why the workbook is so helpful. So now we'll look down here at the treatment schedule. So number of treatments, it's typically about 6 to 8. So if someone came in with just a little bit of cellulite, 6 would be fine. A little bit more severe cellulite, 8 would be better. If they have a lot of fat on their abdomen, maybe they would need up to 10. Just again, make sure you're choosing the right patient. If someone is 300 pounds and they just want their abdomen contoured, they're not going to see a result, because you think of the small area being contoured when the surrounding tissue has a lot of fat volume, it's not going to show a difference. Then taking a girl who's fairly fit and just has a trouble area in her lower abdomen, that's going to show a big result. So you can see the difference there. So also be realistic with the patients that you're accepting for fat. Treatment intervals, 1 treatment every week. Very important that they know this. Very important that they are not planning on going on vacation during this, scheduling conflicts. They need to stay once per week because we need to keep the metabolism revved up and going. So if they're skipping and calling and saying, hey, I can't come this week, I can't come that week, are they going to see a result? No, because it's really based on the metabolism, that metabolic rate that we're getting the body at. So make sure that they're really committed to coming to you once a week. And I always say, pick a day that works for you guys, and schedule it. You know, if they're off on Mondays, then pick a Monday at noon and you can stick to that. Okay, so maintenance, 1 treatment, it's about every 3 to 4 months. If it's someone younger, you know, like a younger girl in her 20s that had a little bit of cellulite, she may hold results longer. But 3 to 4 months would be optimal if they have really the money and the time to do that. Okay. Let me see if there's a few things I want to point out here that are important. The area may be cooled with chilled aloe vera gel only. Yeah, you don't want to cool the area when you're done, because the longer that heat stays, the better. But if there's an adverse, there's a lot of discomfort, there was a blister, then sure, then you could use like cooled ice packs, things like that. A little hydrocortisone, Neosporin if they're not allergic. With cellulite, usually there's not this huge difference after 1 treatment. Usually the big difference shows at like the 2nd or 3rd treatment. So just make sure the clients know that. That's a helpful hint, I think. Same thing with contouring. Cellulite more so, I'd say. Okay, let's move on. Oh. All right, so flushing the applicators. I'm not going to fully go through that. Well, I think I should. This is not necessary unless you have a clog. So if there's a clog within your vacuum handpieces, you'll know. You know, the vacuum doesn't sound quite right. You've checked the filter, you've checked that the filter's screwed in tight, but the vacuum's still not working quite right on one of the handpieces. Sometimes that glycerin builds up in the vacuum tube within the handpiece. So if that's the case, you can take a larger syringe, like a 10 cc syringe, with a bowl of warm to hot water, pull the water in the syringe, and then a 10 cc syringe fits right into the vacuum hole perfectly, and then you push and just flush that out 3 or 4 times. The first time you do it, you'll know if you have a clog, because this gross goop will just fly out of the handpiece, and you'll know, okay, I did have a clog. If you do it and nothing like that comes out of there, then that's probably not the issue. So do it 3 or 4 times until the water is running clear through the handpiece, and make sure that you're tilting it in the direction away from the computer. So you'll see your little computer chip there. I put my thumb on it and hold it in the opposite direction and flush it. And then I lay it upside down to dry, and you can let it dry overnight. So do this at the end of the day if you need it. Each handpiece has 100 hours, which on the machine, it reads out minutes. So it's 6,000 minutes per handpiece. And then you get 2 little tips per handpiece. So what I always recommend is putting 1 tip on and keeping the second new tip in the box put away. And then when you start to notice that the BC is at 3,000 minutes and your tip is starting to kind of fall off, that's when it's time to replace the tip with the new one. And that's usually about half the life. If your tip is not falling off yet at 3,000 minutes, don't worry about it, keep using it. But the reason why we give you 2 tips is because of the wear and tear and the glycerin and the moving and things like that, that they start to wear down. So then that second tip, brand new tip, would be used once that starts happening. So don't get in the habit of interchanging them. Just put the new one away until you're having issues with the first one. Now pull out the new one. So same thing with the FC. Okay. And then these little spray cans for your computer, for your mouse pad, you can take that and dry out the inside of the tube, or just let it dry overnight. That's fine too. Okay, so we spoke about cellulite. So now we'll go into refit. After refit, we'll take that 10-minute break if you need to use the restroom or coffee, anything like that, and then we'll go in and we'll talk about the ST. All right, so refit. The name to me, let's move that back. I need to get more comfortable here. For some reason, this chair is hurting my back today. The name to me reminded me, like if you look at him, like you need to refit his skin back to his body. Refit. So refit is going to be post-traumatic weight loss, like this gentleman, post-baby belly, and they're left with loose skin, or just someone getting older and they have crepiness to their tissue, like the bat wings, loose skin on their arms, or jowling when they start to develop some fat here but loose skin, or loose skin above the knees. This kind of thing where you can see there's either damaged or lost collagen and elastin in the area, and you need to tighten it. So that would be the protocol. Okay, so I'm gonna scroll in here. Refit is really easy to do and easy to remember because you're staying in mode 4 the whole time. Why? So we are starting with mode 4 always because we always have to preheat the patient in mode 4, but then we don't leave mode 4, we stay there. And the reason being is, remember, mode 4, 1/3 of the energy is going to the subcutaneous or hypodermis, 1/3 of the energy is going to the reticular dermis, and 1/3 of the energy is going to the papillary dermis. So this is the reticular here, about that large, and then this would be the papillary dermis. It's smaller, but both have collagen elastin. So if we can have heat going in all 3 depths at the same time, that means all of those fibroblast cells, collagen elastin, are getting hit throughout the whole treatment course. And that's where we get dramatic skin tightening. But additionally, we have connective tissue in our hypodermis as well. And those start to really get affected with weight loss and pregnancy. When we look at histological photos of people that had post-traumatic weight loss, you can see that it's like almost moth-like appearances of the collagen elastin, like a moth had come and eaten it away in certain areas. So this is really for mostly the dermis, but some of the hypodermis too. So we can really tighten that connective tissue throughout the whole part of our skin that's affected, which is great. What's really great is because it does do 1/3 of the sub-Q, if somebody has jowls or just pre-jowling, so when we're youthful, our fat is here, typically in our upper face area and our cheeks. And as we age, we really lose it here and we start to accumulate it in this area, which we don't want, or this area, which we don't want. So we have an accumulation of fat, but then loose skin too. So that's what giving us that like bulldog jowl appearance. So 1/3 of the energy is going to go to the fat and 2/3 of the energy is going to go to the skin tightening, the dermal layers. So it's going to shrink the fat down there and tighten the skin at the same time. So it's really great for jowling. It's one of the most popular protocols for lower face and submental, which is great. All right, so we preheat in mode 4. Same as contouring, RF 2 to 4, vacuum 2 to 4, whatever they're comfortable at, whatever you're needing to use to get them preheated. And then you stay in mode 4. We set the timer for 14 minutes and we do either circles or zigzags or whatever you want, but just making sure you're moving, kind of like a mechanical massage, you're moving it and keeping it heated the whole time between 39 and 42 degrees Celsius. One thing that does change though, after you preheat them and before you set that timer, is you always want to drop your vacuum to 1, because really they came in with loose skin. He didn't come in for fat. Even though he has still a little excess fat that it will hit, he didn't come in for fat. He came in for the loose skin. So we don't want the vacuum to just push all the heat deep into the subcutaneous. We want the modes to do the work for us. So vacuum 1, just enough to get a little circulation to make sure the handpiece is staying on the skin, and letting the mode 4 do really the work for us. If he had stretch marks because of his weight gain, it would also help with stretch marks. Another thing you can do after doing refit over an abdomen for loose skin and stretch marks is that you can use the ST right over the stretch marks when you're done. So you can do a combination of both. I think next 2 pages walks you through everything I just talked about. So just really nice reminders. Okay, treatment course is about 8 to 12 sessions. It takes longer for somebody that has a lot of laxity. Their skin has been damaged and stretched because of weight gain or pregnancy. Their skin has just lost a lot of collagen elasticity because of age. It just takes a bit longer. So about 8 to 12. Now 12 is going to be someone with really more severe post-traumatic weight loss, where 8 would be, a young girl in her 20s who has loose skin from a baby. Usually she'll kind of bounce right back really well because she's young and healthy. But your older clientele that may have gained 200 pounds and held it on their body for 15 years, that's when it's going to be a bit harder, more damage to the skin. They're going to need upwards of 12. Someone that just needs refit joweling, usually you're only needing 8, sometimes 6 to get that result. Interval is going to be 1 treatment every, I would say even 2 to 3 to 4 weeks. Okay, so this is what I like to do. For patients younger than 60, I do every 2 weeks. Patients that are older than 60, every 3 to 4 weeks. So if you want to keep it easy, patients that are older than 60, they would just come in once a month to make it simple. Patients that are younger than 60, then they would come in twice a month. And the reason we need to wait a little bit longer on patients that are older than 60 is just because patients older than 60, their healing response is slower. So if you went in really too soon, you're just not giving the body time to actually heal. And it's the healing process that builds the collagen so well. We have to go in, create a little microthermal injury, get those fibroblast cells to stimulate, and then allow the body to do its job really. So if you're going in too soon, you're just not allowing that time for the actual healing process. And then maintenance would be once every 3 to 6 months, really just depending. I would say your older clientele, I would stick to once every 3 to 4 months. That young 25-year-old girl who had a baby and loose skin, she may only need to come in every 6 months. So that kind of varies a bit. But if you really want to just stay really, on schedule with everybody, then just tell everybody every 3 to 4 months, because then you're going to create a little thermal injury. Collagen takes 3 to 4 months to fully remodel. Great. Then they come back in to stimulate it again. Collagen's a slow process in the body. Oh, someone accidentally typed. I just saw somebody come into the group chat, but I think it was an accident. All right. So that was refit. Any questions there? Okay, so this is our 10-minute break time. So because I never, if you guys don't want to walk away, you don't want to miss anything. But I know you guys do probably need to use the restroom or grab a water, or grab a coffee, or whatever you're needing to do. So we'll step away for 10 minutes and then we'll come back and finish the second half of the workbook. I think we're actually more than halfway through. So let's say it's 16 after the hour. So let's come back 26 after the hour. You don't have to log out because we can't hear you, we can't see you, so it's totally fine. And then we'll just reconvene back here. All right, I'll see you guys. Is that the right word? I don't know. Anyways, see you guys in just a minute. Few minutes. All right. It's time. So now we'll go into the ST applicator. And then our last protocol we'll talk about is the relift. Okay, so we already went through refit, then relift. So the ST. Now the ST does not, oops, sorry. Oh. Try to zoom in here. Okay, so there we go. The ST does not have a vacuum. So we have a precise depth of measurement, and that's the chart here. So with the ST, we're still using the mode 1, mode 2, mode 3, mode 1 being the deepest depth, mode 3 being the most superficial, and we also have mode 4. Now the ST, you know, we can treat, it says the face, the neck, the décolleté, stretch marks, scars, upper knee, arms, so on and so forth, but that handpiece can truly treat from head to toe. We can treat forehead, above the brow and below the brow for a brow lift, even all the way down into excess skin here. We can treat nasolabial folds, contour cheekbones, plump lips naturally with our own natural collagen. We can treat neck, we can tighten hands, we can treat the labia. So there really isn't an area that you can't take this handpiece except for right over the thyroid. And we'll show that with hands-on in a couple weeks. But without a vacuum, we have a precise depth of measurement. So mode 1 being the deepest depth, we're reaching 7.2 millimeters deep. And then our most superficial with mode 3, we're only at 3.9 millimeters deep. Why that's important to really understand is when you're treating different areas of the body. So for example, the forehead, it's always bony. So we would always want to stay superficial 3.9 millimeters deep, because if you choose mode 1, you're just going to bypass the collagen layers, probably reach all the way down into bone and reflect off of bone, and we don't want to do that. So that's why it's really important to understand your modes and your depth of measurement, so you're really choosing the correct modes each time you're using it. Okay, so now I'm going to zoom in here, and our treatment zone is about 10 by 10 centimeters. Really an easy way of knowing your zone size. It's about the size of a woman's hand. So, you know, you can do the full lower left side of the face all in one zone and then move over to the right. If you're doing the neck, same thing, the full left side of the neck and then the right. If you're doing stretch marks and scars, just make sure you're staying in about a hand size zone as you're doing it. Reason being is because if we're trying to treat too large of an area, by the time we start here and then come all the way around and come back to here, we don't want such a large area where the area we started with has already cooled down. Because with the ST, it's a build on heat. So we're doing pass over pass over pass to really build that heat to get that fibroblast cell stimulation. So that's why the zone size is very important. And I'm going to skip down to bullet point here 4. Each pass should not take more than 2 minutes. It's not going to if you're staying at that size of a zone. So that's where the importance is, to make sure you get back to where you started in at least 2 minutes. When passing over the treatment area, we're always overlapping by 10%. So just think of it as you're just right next to one another. If these are my electrodes here, we're going to do a 10% overlap. So you're just right next to one another as you're going. Because there's no vacuum, the heat's really not going to spread too much. Where the BC and FC, the heat really spreads quite a bit because you have a vacuum. Without it, you get a reduction in heat spread, so you want to keep it very tight. Complete each pass by cross-hatching over the nasolabial or marionette lines. So this is for the lower face. And also we're cross-hatching every other pass. What that means is if I do a pass vertically, and then I go down the nasolabial fold, and then I turn my electrodes at the horizontal direction, and I go down it again. The reason why we go down the nasolabial fold twice is because typically that's where it shows the most signs of aging and the earliest signs of aging. So we really concentrate our energy twice after each pass is completed. Then I just finished a pass. Now I'm going to turn my electrodes horizontally, and I'm going to continue down, crosshatch. Now I'm going to go back vertically, down, crosshatch. Now I'm going to come back horizontally. In the workbook, it's going to show that you can actually move in the opposite direction. Totally fine. So you go, let's say, vertically out. Now you're going in for your second pass horizontally. You can go up. The reason why I don't do it that way, I always go from medial to lateral, is because you have points of interest above the jaw, below the lip, right at the lip line, above the lip. And I like that because it keeps me really, what's the word I'm looking for? It keeps me really organized. And if you're going this way, you kind of don't know where to stop and it's just disorganized. So I like points of interest like the lips and the chin and things like that. Okay, just make sure you're cross-hatching the actual electrodes horizontally, vertically, so on and so forth. I'll keep talking about this though. And I'll talk about how you increase joules, ultrasound gel, how you're using it. Actually, I'll talk about that right now, I think. So I'm not sure where it is in the workbook. So I'll just talk about that now so I don't forget. So with the ST, we are always using clear ultrasound gel. Sometimes on different sites like Amazon or medical supply store sites, you can buy blue or green ultrasound gel for cheaper than clear. The problem with blue or green is the dye in it, then it melts down really easily. So when you put a nice thick layer on and you start to move and you start to generate heat, it starts to break down and slide off the face and really melt. So it doesn't stay thick. It's a disaster. So never buy blue or green, even if it's cheaper. My favorite brand of ultrasound gel is the brand that we send to you when you first purchase the device, which is Aquasonic. It's really thick. It works beautifully. So clear Aquasonic is typically the best, and you'll put a nice thick layer of it. So with glycerin, we're using a very small amount of glycerin, right? Because there's no need to use more, and it can, you know, really mess up your vacuum and device if you use too much. With ultrasound and the ST, it's opposite. We're using quite a bit. So usually you have to buy a big thing of it just to store in your office and refill the bottle or bottles. And we're using, it's 2 millimeters thick, but I start out with a little bit more in the beginning and I just get it really nice and thick so I don't have to keep adding as I'm going. So really thick ultrasound gel, it's about the thickness of the electrodes. And then by the third or fourth pass as you're going, that's when you would need to add a little bit more instead of having to add it after every pass if you don't start with too much. So always clear ultrasound gel. You're gonna want some things next to you when you're doing the treatment. You're gonna want a stack of gauze. I prefer non-woven. Woven is kind of messy because the ultrasound will seep through the cracks. So I would recommend purchasing non-woven 4x4. 2x2s are messy as well because they're so small. So 4x4 non-woven gauze. And then a tongue depressor. So what are these things for? Well, one, after every pass is completed, because we're doing a stamping technique, we're putting it down, using good pressure, pulsing, picking up, and then going to the next spot, picking up, and then going to the next spot. So you're making little holes or divots in the ultrasound gel. So that tongue depressor is there for you to smooth out the gel before you're going in for your second pass or before you're going in for your third pass, making sure it's nice and thick everywhere. So never skip that step of smoothing it out. Otherwise, you'll get to a spot without ultrasound gel and they'll jump off the table. And it will either create an arc or it will just be very uncomfortable. So thick ultrasound gel and making sure it's consistently thick everywhere to protect the skin. Because the ultrasound gel, it's working as the conductivity of the energy. It's pulling the energy into the tissue, but it's also protecting the epidermis. So if you don't have enough ultrasound gel, it's going to be uncomfortable for them and it could even lead to blistering. So making sure that tongue depressor, you smooth it out, is right next to you. The pieces of gauze are there, and I recommend doing 6 pieces of gauze because you're typically needing to do 6 passes everywhere with your handpiece. A lot of times you have patients that love to talk to you, you love to talk to them, and you keep going and going and going, and you're like, oh my goodness, how many passes have I just done? I don't know. So if you have 6 pieces of gauze and you know you're doing 6 passes, what we're doing is we're wiping the electrodes after every pass is completed. So then you can count how many, you know, just take your wiped piece of gauze and put it over to the right side, and then you can see how many times you wiped the handpiece, and you can tell how many passes you've just done. So if you start with 6, it will, again, keep you organized. Why are we wiping the electrodes after every pass is completed? It's because inside the handpiece, there's something called TEC, and that stands for thermal electric cooling. And it's a fan. So it's actually pushing cold air to the electrodes to the tip, and it's pulling heat away at the same time. But the electrodes are chilled all the way to about 5 degrees Celsius. So they're nice and cold, and that's to protect the epidermis of their tissue, but to also keep them comfortable. Now, if you just keep going and keep going and keep going, and you allow a ton of ultrasound gel to accumulate and accumulate on the tip, it will end up insulating the tip, and then it really can't properly function or work. And then that fan goes out, and then those electrodes will heat up like a hot iron, and you never want that to happen. So just get in the habit of, after every pass is completed, do a quick wipe. It doesn't have to be perfect, a quick wipe, and then put your piece of gauze onto the side. So that will really help you. Now I'm going to talk about the technique, and then we'll go into this chart here. So I want you to think of this when you're doing the technique. Put down good pressure, pulse, then pick up. Next spot, put down good pressure, pulse, then pick up. 10% overlap. Put down good pressure, pulse, then pick up. I want you to repeat that in your brain when you first start working with the ST, or if you've been having complications with it. If your patients aren't comfortable, or you've been seeing blisters, anything like that. The reason why I went through those steps, putting it down, making sure that you have those electrodes, both of them, because if one electrode's on the skin and one's not, we can arc them very easily because it's delivering into the skin, but it's not receiving from the other electrode. And that's where it creates an issue to the tissue. So making sure both electrodes are nice and solid on the skin. The reason why I say good pressure is because the more pressure we have, the more comfortable they're going to be with higher energy. Imagine if you used high amounts of RF energy and you're just barely touching the skin. That's all they're going to feel. But if you have good pressure, you're tricking the brain. The brain is feeling pressure and not as much heat. So you can go higher in your energy, but additionally keeping them comfortable. So don't be afraid of your pressure ever, ever, even around the eyes. It's like, ooh, it feels weird to put pressure. No, if you don't, they're going to feel a lot of heat. They're not going to be comfortable. So they can even tell you sometimes you're not using enough pressure because they know the difference between what it feels like with and without. So don't be afraid of that. Also, don't be digging into their skin, of course. So put down good pressure, pulse, and then pick up. Some people get in the habit of pulsing as they're putting down, and you don't have any pressure at all at that point. So we have to make sure we have the pressure, trick the nerve, then pulse, and then pick it up. So just always think of those things when you first start using and working with the ST handpiece. Okay, now I'm going to talk about the jewels, and then we'll go into the chart. So the jewels, you're not going to find the jewel levels in the workbook because it's not black and white. I'm just going to give you some tricks that have helped all of the offices work their way up to a higher energy level comfortably. So a good starting point is about 40 joules. You don't want to start at 10. You don't want to start at 20. It's so low that it's going to take you forever to get to your actual high efficacious joule that you need to be at. Starting at 40, you can barely feel it, but you can feel it some. Starting at 40, you're going to pulse 4 to 5 times. So I'm going to pretend like I'm on my face. 40 joules. 1, it could be 38, it could be 42, it doesn't matter. Right around 40. 1, 2, 3, 4, maybe 5, whatever you want to do. Then titrate up to 50 joules. 1, 2, 3, 4, or 5, whatever. Then titrate up to 60 joules. The reason why you're slowly doing this, so I'm going to give you a few things to write down if you're taking notes. Starting at 40 joules is perfect for everybody. Your efficacious joule really needs to be at 60 joules and higher. That's what you're needing to focus on to get them to at least 60 or higher than 60. That's where it really becomes efficacious. I would say the range most people are at, I would say 62 being the low end that most people are at. And I would say 78, 80, maybe 82 is like more of the high end range. 86 sometimes. I would say mid 80s is like the high end that most people can tolerate. I would say most fall into the 70s joule range. So why aren't we just starting at 70 then? If most people end up in the 70s, why aren't we just starting at that? It's kind of like, think of it like you're jumping into a scalding hot bathtub. What are you naturally going to do if you jumped into a scalding hot bathtub? You're going to jump right back out. But if we get into a lukewarm bathtub and we add the hot water as we're in it, now we're comfortable. We're doing the same thing to the skin. We're starting at a lower energy so we can get the tissue used to that sensation, and we're going up 10 joules. Getting the tissue used to that sensation, and we're going up 10 joules, so on and so forth. So then I start to use a number system to see how comfortable they are. So I start at 40, pulse 4 times, go to 50, pulse 4 times, go to 60. Now remember, 60 is our efficacious point. So this is when I start asking them when I get to 60, 1 through 10, what's the heat level for you? Most women, I say women because men may be different, men can sometimes not tolerate as much, but most women would be, they would say that like they're a 1 or 2 heat level at 60. Okay, great. So pulse 4 more times and go up to 70. Now what are you at, 1 through 10? I'm like at a 2 still, great. So just keep going up. Really where I stop is when they say, I'm like at a 4 or 5 heat level. It is bipolar energy, so it's made to be comfortable. So you don't want them miserable. And usually at a 4 or 5 heat level, that's good. Because remember, you're doing pass over pass over pass, so it's gonna build up to more heat for sure. So you don't have to push it really beyond there. What was I going to say after that? There was a point I was going to make and I just forgot. Oh, when I stopped jumping 10 joules, because remember I said 40 to 50, 50 to 60, I stopped jumping 10 joules typically when I get to about 70. So then I'll only do it by 4s usually. So I'll do 70 to 74, ask them. 74 to 78, ask them. 78 to 82, ask them. 82 to 86, ask them. So when you start working in the higher energy levels, usually jumping by 10 is a bit too much for them. So then just take it slower. But in the beginning, you can just titrate up quickly to about 70. Okay. Any questions on that? You can just unmute yourself or write into the chat, whichever. So now we'll go into this chart here. And now we're going to talk about our modes that we're using. So this is for lower face and neck. There is only a chart for lower face and neck. Everywhere else on the body, it's one specific mode that we're using. But the lower face and neck dramatically changes as we age. When we're young and youthful, we have a really nice thick fat pad, we have thick skin, and as we age, we lose a lot of fat. Our thin really starts to thin, and that shows dramatically in the lower face. For the eyes and forehead, for example, those are always bony. So it doesn't matter if they're 18 or 80, we're not adjusting anything. Lower face, we do, because it does change so much. Okay, I was sitting there staring at me. I had to have a sip. Okay, so our chart. Up to 45 years old is considered thick skin. This chart is not black and white. It's actually gray, as you can see. And it's perfect that it's gray because it really is. Not everyone falls into this very specific up to 45 year thick skin, 45 to 60 year medium skin, because oily skin patients hold thicker skin throughout their life. Really dry patients prematurely age and their skin becomes thinner. Smokers, heavy drinkers, their skin's going to prematurely age. Men have thicker skin throughout their life than women. So there's factors. We do give you a chart to go off of, but once you start really getting to know the system and getting to know people's skin really well, you can go off this chart. If they're 48 and they're oily and a male, and you look and go, no, they have thick skin, then treat them as such. So don't look at this as like, you know, black and white, but it's a good starting point. So age up to 45 is considered thick skin. Mode 1, we're going to do mode 1 because it's the deepest depth. We're going to do mode 1 for 2 passes, and then we're going to go to mode 2, and we're going to do mode 2 for 4 passes. Why do we do 2 different depths? Because we have the reticular dermis and we have the papillary dermis. That's why we need both. Then 45 to 60 years old, considered medium skin. We don't want to do mode 1 because it'd be too deep. It would just go into the fat because it's thinner skin at this point. So we're going to do mode 2 instead and mode 3. And then older than 60, considered thin skin, we definitely don't want to do mode 1. That's going to be much too deep. That's really going to bypass our dermal layers, and that's what we need to focus on. So we're going to stick to thin skin mode 3, most superficial, for all 6 passes, okay? And I already walked you through how you would do the lower face and the neck. So those are the modes that we would use. Remember, we're cross-hatching every other, we're smoothing out the gel with the tongue depressor, we're wiping the electrodes. I talked about titrating up the energy. Yeah, I talked about all that. Okay, so now we'll talk about eyes and forehead. And I'm sure I'll talk about more when we're doing hands-on in a couple of weeks too. Eyes and forehead. So the eye, actually, let me start with forehead because it's easier. The forehead, I usually split it in half. I don't know why. I guess because it keeps me more organized, but it is one zone size. So you can do it all on one if you'd like. And you're going to do the same thing. You can go in the opposite direction if you'd like, cross-hatching the forehead, but it's the same thing other than you're just always using mode 3 because it doesn't matter if they're 18 or 80, that's a bony area. Always mode 3, the most superficial. And same with the eyes, mode 3 always. Eyes, we split it into 4 sections. Reason being is it takes longer to do the eyes. So if you try to do the full eye in one pass, it's going to take too long and it's going to, the area that you started with is going to be cooled down, so you're not going to get an efficacious response. So we want to split it into 4 sections. I usually start under the eye first. Doesn't matter. As long as you're doing all 4 sections, it doesn't matter where you start. So I usually start under, do 2 to 3 rows. I usually just do 2 because most people don't need 3. All 6 passes, and then you move on. I usually go to the crow's feet then. I have them smile so I can see where they're creating their crow's feet. If they're Botoxed, like me, my Botox is starting to wear off, but I'm still Botoxed, you'll guess where their crow's feet would be. And usually it's about 4 rows right about here. So all 4 passes, or I'm sorry, all 6 passes, and then you move on, 4 rows. And you can come right up to the lash line because there's a bone there. It's keeping the eye safe. So you can come all the way and treat these fine lines and wrinkles right by the eye, which is great. Then I go above the brow and I start in the glabella because any type of these lines that people create, again, I'm Botox, but it's starting to wear off, but those frown lines, you want to treat those. Even if they don't have them, you still want to treat there. So starting right there in the middle of the glabella and then just follow along the brow. And then second row, right above where you just went. So 2 rows is plenty to give a brow lift. You don't need to do any more than 2. So 2 rows, I still go medial to lateral here, cross-hatching it, and then you go below the brow. And hands-on, I'll show you how to do that when we do that in a couple weeks. But you can fit anywhere from 1 to 3 rows here, depending on how much excess skin they have, or natural hooding that they have. All 6 passes, and then you move on. So again, we'll talk about that more in a couple weeks. It does say to do at least 4 to 6 passes here. I always do 6 on every area. The only time I'll ever stop and do 4 to 5 passes, less than 6, is if they're older, typically thin skin, they have a ton of redness, you can see the erythema, and you don't need to push it beyond there. You can visually see that you're building enough heat. That's when you can stop. Most people need all 6 passes though. Okay, now the next. Décolleté and stretch marks. So stretch marks and I'll talk about décolleté last. Stretch marks and scars, this is when we're using mode 4. So this is the only time we're using mode 4 really with the ST. And the reason why we use mode 4 for stretch marks and scars is almost every stretch mark and or scar is deep, very deep, but it also is superficial. So mode 4 is all 3 frequencies going at once. So you're really getting the depth of the stretch mark or scar, and you're working more superficial for it too. So stretch marks and scars, they're the hardest things to treat because it's dead tissue. However, it is surrounded by healthy cells. So it's those healthy cells that we are stimulating to help shrink the size of the stretch marks and scars. They may need some additional things like microneedling, peels to help the texture of it. So you can do combination if you're needing to, which you usually do because those are hard to treat. Décolleté, usually you're using mode 3 for décolleté because this is typically bony, or bra lines here, right in between the breast tissue. But if they have thick skin there, or even like a little fat pad, then you can use mode 4 in that area. I think I have pretty thick skin in that area, so I could potentially use mode 4 on myself. But if you question it, if it just feels kind of thin and bony, then just use mode 3. Number of treatments, about 4 to 6. Now, I don't ever recommend selling 4. Even if you can get there and you can and they're happy at 4, what if you didn't? You know, what if you did 4 and it could have been a little bit better? I always recommend selling a little too many than too little. So I would recommend more a small package of 6, a large package of 8 for the ST. Treatment intervals is 1 treatment every 2 to 3, even 4 weeks. It's pretty much the exact same as refit. It's collagen. So if they're under 60, it's great to have them come in every 2 weeks. If they're older than 60, they need to wait because of the healing response. So every 3 to 4 weeks is best for them. And then maintenance, 1 treatment every 3 to 6 months. So younger clientele can typically hold results longer. Let's say you were treating the labia on somebody who was 25 who had a couple babies. Their result can a lot of times last where they only need maintenance every 6 months. If you're treating a 65-year-old lady for her eyes, then it's best to keep them on a 3 to 4 month schedule for maintenance. Cleaning the handpieces, we're always just using alcohol, 70% alcohol. I like to spray down a piece of gauze with the alcohol and then go in and clean either the ST or the BC and FC with that, but I'll show you that too with hands-on. I spoke about the tech cooling already, but that's right here. I wasn't sure where it was in the workbook, so I wanted to make sure not to forget to talk about it. The amount of hours is 1,000 with the ST, so it reads as 60,000 minutes on the system, and it counts down from there. All right. So it says redness and swelling in the treatment area is to be expected. I just want to mention that with the ST, if you see no redness and they feel very little heat, you're probably not doing much to the skin. So it's kind of based on you as well to see a bit of pinkness to the tissue and for them to really, you know, feel the heat, not uncomfortably, but they should feel it for sure. Okay, last protocol, and then we are done. Try to zoom out. Oops, too much. So now we'll talk. Oh my goodness, why do I keep doing that? Okay, so now we'll talk about the relift protocol. So relift is really takes a specific patient. So it's someone that's going to be older. So you can see signs of aging on their neck. You can see signs of aging on their lower face. And typically they're carrying a lot more fat volume. So, you know, they have the jowls, but it's, you know, it's pretty heavy in the lower face, and it can even be heavy here. If they're not, if it's just a little loose skin and a little bit of fat accumulation, then they would just need the refit, which is the FC in mode 4 the whole time. If they're bone thin without any fat, then they would just need the ST for the lower face and or neck. But the relift is if someone comes in and they're a bit heavier and showing signs of aging, then the relift is perfect. So the relift is going to be a combination of the FC applicator and the ST applicator. It's a 9-week protocol. They're coming in every week for 9 weeks, and it's going to be just switching pretty much these handpieces and protocols. So week 1, you're going to do the FC handpiece and the contouring protocol. So you're contouring that fat down. Week 2, same thing, FC, contouring that fat down. Week 3 is the ST, and you're going to do full skin tightening on the lower face and the full neck. And then you do that 2 more times over. So then the 4th week would be back to contouring. 5th week would be back to contouring. And then the 6th week would be skin tightening. And then week 7, contouring. Week 8, contouring. Week 9, skin tightening and full neck. Pretty easy. So contouring, contouring, ST, contouring, ST, contouring, ST. So you can see how many times we contoured. That's because they had quite a bit of fat volume to contour down. And then this just walks through. So here's a picture of someone that really would be a great candidate for that. You know, much more fat volume, and signs of aging for sure. If she had like a quarter of this fat or even half, she would be more refit. If that's hard to understand, I get it, because this system does so much for the lower face. We can contour it, we can do refit on it, we can do ST on it, we can do relift on it. I get it, it's a lot. It will come to you. You know, just keep reviewing. You can keep watching the webinar, keep reviewing it, and it will come to you. If you ever have any questions though, like, I have this patient, take before and after photos, send them to clinical, and we can tell you, this is the protocol I would recommend for you. We're always here to help you with those type of questions until you get, you know, a good understanding of what protocol to choose. So if you ever want to email us those questions, you'll just email us at clinicalusa@vioramed.com. And then maintenance would be once every 3 to 6 months. To, you know, to continue that. I bet you anything this is Donna. Oh, nope, I thought Donna wrote in the clinical email address. How can I rewatch this webinar? Let me know if you're overseas or not. If you're overseas, I'll have a different answer. If you're in the US, I'll have a different answer than if you were overseas. I'm in New York. Perfect. So what you'll do is you'll go to myviora.com, customer portal, VSP, it stands for Viora Support Program. Once you click on those things, then that will take you to the main page where it has the pictures of the devices. And at the bottom right corner, you'll see Viora Academy webinars. And there's all the webinars I've done from the start of the pandemic. So there's a lot of them. And you can just watch them anytime you'd like. And under that customer portal, if you click on your device after you see the webinar, find the webinar area, if you click on your device, that's where all like the training materials are, like this workbook that I'm showing you right now, consent forms, treatment logs, cheat sheets, anything like that that you need is in this customer portal. So just play around in it and get to know it. Thank you so much, Donna. You are the best. So she just wrote that out, myviora.com, click on customer portal, click on VSP, click on Viora Online Academy webinars. For international, you'll go to www.vioraonlineacademy.com and register to watch the recording. If you did not register to watch the recording, that's okay. We can still accept you so you can watch it in the future. Yeah, you're so welcome. And thank you, Donna. She's always so helpful and always on these webinars with me, and I'm so grateful for her. All right. Okay, so then these next few pages, there's just a little bit of practice development help, how to take great before and after photos. I did a webinar on that, so you can just watch that. And here's just some tips and tricks, measurements. I'm not big into measurements, but you'll hear me talk about that on the webinar. And then here's some just information of really like before and after treatments. So we do have a sheet that you can print out for the reaction, and I would print out a stack of these for every patient in a consultation. So once they purchase a package, you can hand them the sheet, and it's everything to do before their treatment or not to do, and everything to do after the treatment or what not to do. So example, it would say, ensure that there's at least an hour between your last meal and your abdomen treatment, because it can make them uncomfortable. It sometimes can even stimulate a bowel movement, so you know they're not comfortable on the table. Drink at least 1.5 liters of water before each treatment session, so they remember that. You know, talking about exercise and when to do it, setting expectations, what not to do and what to do after the treatment. So they're very helpful, and you can find those on the customer portal as well. It walks you through proper ways of treating, oh my gosh, no, that's what the whole webinar was about. Proper ways of charting each treatment. So we have those charts in the customer portal that you can get. You know, contraindications, we went through that. There's pricing strategies in this workbook. Really anything you're really needing practice development wise. Some of it's in here, but most of it is in the customer portal. And I did a huge long 4-hour webinar with Heather on practice development. So you'll learn more from that than really you would reading this. So I recommend watching that one as well. And that is the end. Any questions before we get off? Can you also send an email where we can send pics of clients? Same. So it's clinicalusa@vioramed.com. clinicalusa@vioramed.com. So that's when you can send pictures of clients like, hey, what protocol would you use? Needing help? Of course, you can always email us with those kind of questions. That's what we're here for, and we're more than willing to help you with anything like that. Any adverse events, anything. Yeah, you're so welcome. Okay, so just a reminder, in 2 weeks is when we're going to be doing hands-on. So showing you different, you know, treatment protocols and how to work with the reaction. So that will be not this Friday, but not this coming Friday, but next. And I think that's about it. Enjoy your weekend. Thank you so much for joining. We really appreciate you guys always being on. And stay healthy and stay safe out there. All right. Bye, you guys.